Hello, I'm Kim Higdon and I'm doing a medical assessment on Sally Cockrell, my patient. We're first going to watch her walk in. We'll sit down and ask her some questions and we'll do the actual physical assessment. Okay, so come on. Hi Sally, so when she walks in, some things that you kind of notice: she's well groomed, her hair is well groomed, she walks, her gait's even. I'm going to have her just sit on the edge of the bed now and ask her some questions. First of all, what brings you here today?
Just for a wellness check.
Okay. When you sign in for an abscess on your left buttock.
Oh yeah, I just didn't want to tell you because that's embarrassing.
Okay. Okay. How about you tell me a little bit
happened
about
just
it?
a couple of days ago, just out of nowhere. Just was a little pimple and now it's big.
Okay. I show that you've been on Bactrim twice a day for it. How long have you been on that?
3 days.
Okay. And it said the ER that they did they lanced it, put you on the antibiotics, and it's just continuing to get worse, correct?
Right.
Okay. Tell me a little bit about your past medical history. As a child, any past medical history, hospitalizations, accidents, anything like that?
I had pneumonia when I was a little kid, but that was it.
Okay. Tonsillectomy?
I had my tonsils taken out at 7.
Okay.
No complications from that. And then a couple of years ago, I had a sinus surgery.
Okay. What about your immunizations? Do you stay current on them?
They're all up to date.
Okay. Did you take the flu shot this year?
I did October 2nd.
Okay. And so your operations are tonsillectomy at age 7, and you had a sinus surgery about a year or so ago with no complications, correct?
Right.
Okay. Any mental health illness?
No.
Okay. Tell me a little bit about your nutritional status. How do you eat?
Every day, 3 or 4 times a day, sometimes 5 or 6 times a day.
Okay. What do you mostly drink?
Water.
Okay. Do you work out on a regular basis?
4 to 5 times a week.
Okay. And I show your allergies are to penicillin and it breaks you out in hives. Is that correct?
It was a childhood allergy, so I don't know if it's still active.
Okay. Tell me a little bit about your family history. What about your dad? Is he still living? Okay. Does he smoke, drink, any heart, lung, diabetes?
He's got diabetes and he smokes.
Okay. What about your mother? Is she
She's still alive. She's healthy. She's only had a hysterectomy.
Okay. What about your your maternal grandmother?
She's no longer here.
Okay. What'd she die of? I show stroke.
She had a stroke and lung cancer.
Okay. And then what about your paternal grandmother?
She died of Alzheimer's.
Okay. What about your maternal grandfather?
He's dead as well.
Okay. I show heart disease, heart attack.
And lung cancer too.
Okay. What about your paternal grandfather?
He's still alive.
Okay. What about your brother or brothers, sisters? How many do you have?
Just have one brother.
Okay. Any problems with him at all?
No.
Any children?
Nope.
Okay. Any other family history that I need to be aware of? Okay. Tell me a little bit about your social history.
As far as,
Like,
I don't smoke,
okay.
drink socially.
What do you do for a living?
I'm a nurse.
Okay. Are you married?
I'm single.
Okay. What's your culture, background? I mean, your religious background, any
Baptist.
values? Okay. Do you drink at all?
Just socially.
Okay. No smoking, no tobacco?
No smoking, no illegal drugs.
Okay. So you can tell she appears well groomed. Sorry, get right here on the thing. She's well groomed. I mean, you can look at her nails. They're well groomed. You can do capillary refill less than 3 seconds. You can do grip test, squeeze. Okay. Skin's good. Hair's even, distributed. I do show a mole on the back of her neck about 3 millimeters in size. We'll kind of just go through, I mean, her skin's pink, warm, dry to touch. We'll do some different tests to make sure, like, she's, you know, stable, like no abnormalities that we find. Okay, now we're going to do the physical assessment part of this. So we noted one mole on the back of her neck. When you raise her hair, there's a small 3 millimeter mole on the back of her neck. And she also has another mole located on her right ankle on the outside. So there's a small mole right there, maybe 2 millimeters. And while we're looking at this, you can look at her feet and tell there's no calluses, they're well cleaned. Her toes, no hammer toes. I'm going to have her hold her head upright. You can tell it's upright position. There's no bobbing or anything. We'll have her smile. No facial drooping is noticed. She looks evenly at me when she opens and closes her eyes. That checks some of your ocular nerves. Like she can look to the right, look up, look down, look to the left, close your eyes, open your eyes, raise your eyebrows. She can do all of that without difficulty. Then we'll do kind of just a quick little mini assessment, and then we'll do some of like the other tests that we need to do to check like her, to make sure that her knees, like no tears in her MCL, ACL, and things like that. So we'll do a quick mini assessment. We just kind of go through her head, feel behind her ears. We don't feel any enlargements, lymph nodes, and anything like that. Her trachea is even, there's no JVD distension. She's symmetrical here. We'll have her raise her arms above her head. She can do that without difficulty. Can you hold them out? If we were doing a female, we would have her be in a gown and we check in her armpits and stuff to make sure there's no lymph nodes or no swelling. She denies any of that. She denies any lumps in her breast. She does monthly breast examinations. I'm going to have her just lay back a little bit. And we're just going to kind of go down her leg, make sure, she doesn't have any pain or discomfort. She denies any when I'm doing that. We'll have her push up, flex up. She can do that without difficulty. We'll test for the MCL tears, and so you just have her bring her knee up like this. And you put one hand here and you rotate it inwards and outwards. You notice if you feel any popping. Do you have any pain or popping when we do that? And I'm sorry, that test, I apologize, is called the, that's called the Trenenberg test, or I'm sorry, it's not the Trenenberg test, it's the McMurray test. So we'll check the other 182, we'll bring it up. We'll feel your distal hand on, rotate it inwards and outwards. Any popping or anything that you notice with that, no pain with that. Have her bring her legs back down. I'm going to have her stand up for a minute. And I'm going to stand behind her and do the Trenenberg test. So I'm going to stand behind her and I'm going to have her stand up on one leg for 30 seconds. 2, 3, 4, 5, 6, 7, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. She doesn't have any problems with balance that we appear. She stays symmetrical. She can go ahead and sit back down. We can check the vagus nerve, like I can have her swallow. And she can swallow. You can also check thyroid to make sure she can swallow as well with that. We'll check her accessory. We'll check her accessory nerves by having her shrug her shoulders. She can shrug them without difficulty. We can do the point to test nose where she brings her arm out and I want her to touch her nose. Close your eyes. Touch your nose with your right hand, okay? Touch your nose with your left hand, okay? And then we'll check, I'll look in her ears and her eyes real quick. So I'm going to just have her sit back just a little. I'm going to take a look in her ear. And you just change this with this, The eardrum is intact. You can see little hair follicles. There's not really any wax. It's kind of a pearl white color. And that fell off. And then we're going to go to the other side. I'm not sure she can still see it. Okay. We'll look into this one. And it's the same thing. It's a white pearl. The eardrum's intact. You can see hair follicles, but the color's white pearl with a little bit of pink in the color. And you can also look at her nose with this. But you want to change out the speculum. You don't want to use the same one. So I'm going to look up at her nose. Sorry. And, you know, it's kind of white in color with a little bit of pink. There's no, I mean, I don't really notice any abnormalities. And then you can take this and look in her mouth too. We want to look in her mouth. We're going to have her open her mouth. It looks moist, pink. I don't notice any sores. You can see on the left side where she has her caps.
Oh, hi,
Sorry. Her teeth are good and clean. They're white. We don't notice any abnormalities, no odor or anything like that. Then we'll look at her eyes using this. Just kind of adjust it a little for what we're looking at. Kind of have her open wide. And I'm looking at her, you know, it looks, I mean, I don't notice any abnormalities, broken blood vessels. The color looks good. No bulging. No, you can see the redness from the retina. And her eyes are green in color, greenish blue. Next, I'm going to listen to her heart and lung sounds just to make sure they're not abnormal. I'll just have her set like this. And you start from one side. Have her take a deep breath. Out. In and out. And you go straight across and do it again. In and out. In and out. And you go down. Listen to the lower lobe. Right lower. And then you go to left lower. Her lungs sound good and clear. Then I'm going to go to the front and listen to the front side of them. We'll start with the right side. Deep breath in and out. Okay, again. Then I'm going to listen to her apical pulse just to make sure that she's perfusing, make sure I don't hear any abnormality beats. I'm also going to feel a pulse while I'm doing that just to make sure she's perfusing. You listen for a full minute. Okay, so I get 68, and then I'm going to check her blood pressure manually. You just always tell your patient what you're doing.